Alright, with denture care, you're going to start at the sink. You're not going to start with the patient. You're going to start with the dentures first. Okay? So, you're going to knock on the door, introduce yourself, name and title. You're going to address the patient by name and let the patient know that you're here to provide denture care. You're going to care for their dentures. Okay? You're going to come and do a hand washing technique. After you do hand washing technique, you're going to go back to the client, check the ID, make sure the client is the correct client that you're going to be rendering the skill to. You're going to let them know that you're going to begin the skill. You're going to start with the dentures. You're going to gather your equipment and the dentures. You're going to put everything on the overbed table, and you're going to bring everything over to the sink, and we're going to start. Okay? So, this is a glove skill. You're going to wear some gloves. You're going to put tissue on the counter. You're also going to have tissue on the overbed table. You're going to have your dentures. The denture cup has another cup inside of it that is removable, right? You're going to open up the commode. Any water that's in here, you're going to dump it in there. Okay? You're going to put this here. You're going to get some tissue. You're going to turn on the faucet, and you're going to check the water level. And the heat of the water should be cool water, not hot water. Hot water will warp the dentures and messes up the dentures. No hot water for dentures. No hot water. Alright? No. Tepid, like room temperature. It's not cold, it's not hot. Room temperature. You're going to take this out. We're going to rinse out the cup. Okay, make sure the cup is nice and clean to receive the dentures. Right. Rinse this out. Make sure there's no residue. You're gonna get denture brush. Denture paste is different. You're gonna put some. You're gonna get the denture. And we're going to start cleaning the denture. Now, you already know how to brush teeth. So it's the same thing. You're going to brush all the surfaces of the teeth. But with the dentures, the inside, there's like a concave. There's like a oval shape in the middle. You have to clean in there. Because that's where they put the denture paste and they squeeze up on the roof of the mouth. And then the denture paste, the adhesive rather, spreads and keeps the denture in place. So you have to scoop that out after you clean all the teeth. You're going to hold the teeth like this. Do not hold them like this. No. Like this. No. Why? Because you could crack them in half. You could crack them in half. So you're going to hold them like this.
Like what?
So, like this. The front teeth, take your index finger and your thumb and you hold. You're going to take the toothbrush and you're going to wipe away from you. Scoop it out. Scoop it out. Scoop out. Don't scoop in because then all that bristle stuff flies in your face. So you're going to scoop out. And you're going to rinse all the surfaces of the teeth. Rinse all that out. Don't leave nothing. I already made a mistake. This prevents the denture from this. Did you hear anything? No, right? Now, if it was bare, what happened? The denture cracked. Right? So you're going to have a barrier there. In case you're brushing, it gets slippery, it falls, cushion, the water acts like a little pool.
So before you rinse, you put that in there first.
Right. Okay. So rinse all of that out. Make sure the tooth is clean. Then you're going to get the lower part. You got to do the lower part. just like you did the upper part.
same way.
You're gonna hold and you're gonna brush all the surfaces of the teeth. You gotta put more paste, you put more paste. Right? Then you hold, and in the bottom teeth, you're gonna go in the canal. Right? Because the bottom teeth, right, your tongue is in the way. So there's like a canal that you put the paste and you adhese it to the bottom gum line. And it keeps this denture in place for the person. So you're going to take the toothbrush, you're going to go inside the canal, and you're going to wipe away or scoop away from you. Don't do it towards you because then the bristles, all that stuff fly in your face. So you scoop away. After you scoop away, rinse the brush, right? You can put it up here. Rinse the denture. Make sure you don't leave nothing. You're going to put it in here. Then you're going to take the cup and you're going to fill the cup with water up to here. Up to this second cup that's inside the cup. You're going to fill it up with water. The dentures are never to be stored dry. Always to be stored in some water. So you leave that on the side. You're going to take this out. This, of course, you know is going to go in the handful. But I'm going to leave it right here so it can dry. That goes in the handful, soil linen. Tissue goes in the garbage. You remove your gloves. You do hand washing technique. Tissue. Turn off the faucet. Now we're going to go to the client and work on the client.
This is a long part.
This one is long. So I come to the client. Hey, Miss Jones. I'm done with your dentures. I'm going to swab your mouth. She's going to say, okay. So now I'm going to swab her mouth. I'm going to raise the head of the bed. Lock the wheels. Raise the bed. Raise the head of the bed. Make her to sit up. 45 to 60 degree angle. We're going to provide the privacy. Right? Her dentures are done. I'm going to put them in her drawer. They're nice and safe for her. Face cloth. And these are the lemon glycerin swabs. I'm going to put on new gloves because I'm going to swab her mouth. These are sterile in here, so you don't want to touch it with your dirty hands. Open the package. There's 3 of them in here. I'm going to show you them. See, they look like big Q-tips. They have a wax coating on them, like a waxy base. They also have disinfectant in it to deodorize and disinfect the gum line. Because sometimes the dentures back and forth, it bruises the gums. If they eat a lot of hard stuff, they get little cuts in their mouth. So this will help with any infection, okay? Not to set in. The wax coating also helps to prevent the dentures from doing any further damage. It makes it smooth to remove and put back in. So there's 3 of them. You leave them inside. You're going to use one at a time. You're going to ask the client to open wide as far as they can, right? You might have to help with the finger on the side of the mouth. You're going to take the swab. You're going to go inside, in between the cheek and the gum. And you're going to run all the way around till you get to the other side. And you're going to come out and you're going to put it in here. Okay? and they're going to bring this, they're gonna gargle, spit, and you wipe. Next one, down bottom, same thing. Go towards the back, all the way around the gum line, all the way around till you get to the other side, pull it out, drop it in there. In the water, gargle, 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 spit, you wipe. The last one goes on the roof of the mouth, not the tongue. There's no tongue involved in denture care. In denture care is the roof of the mouth, because remember I told you that plate, the top piece, they put the glue, they squeeze, the glue goes all over the roof of the mouth and keeps the denture in place. So now they have adhesive still left there and sometimes food particle. So you have to get all that out. Then I ask the client to open up wide. You're going to go in the middle of the roof of the mouth and you're going to wipe outward like this, concave shape. So this is the roof of the mouth. This is the front of the gums. You're going to go in the middle and you're going to wipe out. Might have to do it twice.
Do the same one?
Bring this here. Bring this. Bring this. She gargles. She spit. You wipe. Make sure she's nice and dry. You okay, Mr.? Yeah, we're done. Want me to put the TV on? And put that up. Lower the bed, lower the head.
For how long you go to leave her without dancer?
So she's ready to put them in.
Ah, okay. Thank you.
Usually they take them off and put them on by themselves. Sometimes you don't.
Oh.
Make sure she has her core gun. Then you're gonna get rid of this. You're gonna put on new set of gloves. New gloves, and this is gonna go in the soil linen. All this stuff, all the paper items go in the garbage. All of this goes in the commode. You dump it, right? You're gonna get tissue, turn on the faucet, get the water, dump. Water, soap, wash with a tissue over the commode, dump. Water, rinse the soap in the commode, dump it. Last water, rinse in the sink, dry. This is personal equipment. This goes in here. All of this goes in supposedly in the garbage. Take off your gloves. Do hand washing technique. Come back. Tell the client everything is done. Tell the proctor the skill is complete. And